I'm Dr. Clark Metzger. I'm an orthopedic spine surgeon at HCA, Florida West Orthopedic Specialist. I do just about anything in the spine, anterior, posterior. My areas of greatest specialty are spinal cord stimulation and anterior neck surgery. Those are the two surgeries I do most commonly, but I do laminectomies, lumbar fusions, thoracic procedures, discectomies, that type of thing, all using pretty much minimally invasive techniques. The most common patients I see are the people who've had multiple surgeries before, have been told over and over, there's nothing we can do for you. Those are the people who are generally sent to me to look into spinal cord stimulation. We have a lot of options in terms of spinal cord stimulation to getting these people better, and with the vast majority, we are able to get better, but the interesting thing about spinal cord stimulation is I don't make the decision, the patient does when they have a trial done by their pain management doctor. It's pretty cool having, getting a bunch of people who have been told there's nothing we can do for you and get any better. Anterior neck is generally done for people with neck and arm pain. One of the misconceptions about neck surgery is that it's done for neck pain. It's really not. It's done largely for arm pain. Same thing is true of lumbar surgery. It's not generally done for back pain. It's done for lower extremity pain from nerves being pinched in your back, either from disc herniations or degenerative stenosis, things like that. Generally with spine surgery, we're taking somebody, we create a little pain, we do the surgery, usually there's instantaneous relief. I, in fact, have had a laminectomy, went to sleep with searing leg pain, woke up with no leg pain, and my back hurt, as expected. So it's really that we get kind of an instant gratification. That's true with anterior neck surgery, it's true with spinal cord stimulation. We turn their stimulator on the recovery room and all of a sudden they've got pain relief they hadn't had in years.